Healthcare delivery in Nigeria faces another setback as doctors in Abuja embark on an indefinite strike, with negotiations stalled and grievances mounting over pay, working conditions and systemic neglect. The walkout raises urgent questions about the state's commitment to public health care. As patients bar the brunt, the political implications of this industrial action grow louder. Now, joining me to discuss this is Dr. Affiong Agbor. She's the General Secretary of the ARD-FCTA Association of Resident Doctors. That's Association of Resident Doctors of the Federal Capital Territory. Thank you so much for your time.
Thank you so much for having me.
All right. Great, good. So let's get straight to it, right? What are your demands? We know that you have a list of demands that you according to your association, you feel that the government has renegated on. What are these demands?
Thank you very much once again for having me. We have numerous demands actually, but top on the list, if I'm to start from, is actually the shortage of manpower. This cannot be overemphasized. I don't even know how we can stress this, how bad this is. The shortage of manpower in our hospitals is terrible. You know, a situation where you are having one doctor doing the work of 10 doctors. Let me don't bore you with all those. Let me just give you a typical example. For instance, it's so bad that one doctor you can be operating in the theater, like doing a cesarean section, and they'll be calling you that there's another patient in A&E or maybe labor ward bleeding, and you know, in a normal setting, there should be at least one or another extra doctor waiting to see these extra emergencies if you are operating. So in that situation, what do? You need to leave the patient you've already opened up to go attend to the other patient that is bleeding. In fact, it's also so bad that, you know, normally surgery, you're not supposed to be a doctor doing the surgery. You're supposed to be the main surgeon and the assistant. But in FCTA, most times you find one doctor doing a surgery alone with just the perioperative
Dr. Agbor, just to have some clear perspective as to how, will I call it, grave this situation is. You gave a scenario where a doctor might be carrying out an open operation. The patient is on the table, opened up, and then while he's at it, he gets another call of an emergency, and so he has to leave that patient and attend to the fresh call. Is that how terrible the situation is?
That's how terrible. Although we don't have to leave, because you cannot leave a patient you've already opened up to go attend to another patient. But I'm just saying that is the doctor expected to leave that patient you've already opened up to attend to another patient? So sometimes that patient bleeding there is left there because you can't divide yourself into two places. You have to finish a surgery already ongoing. Because you are the only doctor on ground. Sometimes you are doing that surgery alone with just the nurse.
So basically, there is
that's how bad the situation. So that's one of our problems.
It's grossly understaffed. That's what you're saying. It's grossly understaffed.
Yes, we are gravely understaffed. Now, another problem we have is that our working condition is terrible. We don't have the facilities to cater for the number of patients we are seeing. It's so bad. Like, let me use Yaya General Hospital or Kuba General Hospital, where they have 20 doctors, approximately 20 doctors, catering for about 15 to 20,000 patients per month.
20 doctors, sorry, to understand it, 20 doctors to 15,000 patients.
Doctors. 15 to 20,000 patients per month. So please do the math. What's the ratio to one doctor to a patient in that kind of facility? And if facilities sometimes have 40, not even the facility, not sometimes have facilities have, you can go and confirm, 40 to 45 beds to cater for 15,000 patients in a month. Which is the reason why you come to a hospital, we are referring patients. And patients sometimes think it's the doctor that wants to refer. It's so bad that sometimes in an emergency setting, you don't even have a couch to examine a patient. And when you refer these patients, unfortunately, sometimes most of them die on their way to another facility. And you see patients coming to sue us that because we referred. I mean, there are no bed spaces. So we, at the end, the doctors, are the ones suffering the consequences of what the system should be suffering.
So what I know that efforts have been made in the past to draw the attention of the government to this. What commitment have they given?
we've made several efforts. We've had a lot of dialogues. They've even done the statistics. Funny enough, the statistics I'm giving you, they have it on their table. But they keep making promises. Give us time. Give us the budget. We are working on it. And it gets to that point where we are like fed up. Like that situation where people say, you say that you keep quiet and die, or you speak up and die. So which will you prefer? So we decided to pick the part of let us speak up. So if anything happens, at least the whole Nigeria will know that this is the situation we find ourselves. So this strike is mainly to create awareness. First of all, create awareness. Let Nigerians know that when you come to the hospitals and you see some of these problems, don't blame the doctor. It is not our fault. And we are not doing this for ourselves. It's more for the patients. You understand? We cannot give you that standard of care that you deserve. Not that we don't know what to do. We know what to do. But we are in a situation where we don't have what to work with. We are overworked. How do you even feel comfortable allowing a doctor that has operated on 10 patients in a day to still operate on you? Is a malpractice as far as I'm concerned. So we've had this discussion with the government. They keep promising us, but we can't keep waiting on their promises, because it gets to a point where we are going to have more avoidable accidents, both on patients and doctors, if we don't do something about it.
All right, let's look at the aspect of even your welfare as a health practitioner. Are there concerns around that too?
Yes. In fact, I don't even know where to start from, because the welfare, first of all, we know our salary is nothing to write home about. But then the salary that is nothing to write to my heart, the take-home pay.
Can you just give Nigerians an idea of, you might not say specifics, but give a range?
Okay, well, if I'm to say a take-home pay of a startup pay of a doctor that just came into service is so poor, it's not even up to 300K if I'm to shock you.
Of an average doctor.
And yes, of an average doctor. And yet they pay you so epileptic. They can pay you this month on the 10th, next month they pay you on the 8th, this month they pay you on the 15th. And when the money finally comes, rather that you see some of our doctors, like last month, we had 100K short of our salary, 50K short of our salary, 30K short of our salary, with no explanation as to why these shots are coming from. And this has been occurring. It's not just start today. It's been occurring for months. And we tell they can't keep paying us this way. That's number one. Number two, they are some of our doctors, because they've not employed for since 2011. They've not been in major employment. What they've done is an epileptic replacement. If, for instance, 10 doctors have left and are replacing with 2. Now, these few doctors they replace came in 2023. They owe them about 6 to 9 months salary.
They owe doctors 6 to 9 months salary.
Yes, salaries, not arrears. Salaries, please. We are not begging for arrears. 6 to 9 months salary for a doctor. See, it's so bad that I personally, I have given my colleagues money to buy antihypertensive because they can't even afford it. They've been living from one debt to another, so they can't even pay house rents.
All right.
So we've been begging, pay these people their salaries. It's not arrears we're asking for, please. Pay them their salaries.
All right.
2023, 2024, this 2025, and they are still giving us stories. That's one of the welfare. Now, there's another welfare, medical residency training funds. I don't think there's any profession in Nigeria or even in the world that can be up to standard without being trained. Talk more of the medical doctors. We are dealing with lives. There are lots of recoveries every day. So we need to be training. We train yearly. Different doctors are supposed to be training depending on your level. Now, this medical research training fund is not even available to sponsor. It doesn't even.
All right, Dr. Agbor, because we are really trying to manage time, and I know that you said quite a couple of things, and I'm sure that they are watching and they're listening. How long do you hope to hold this strike for? And in 30 seconds, please, your final take.
Well, this strike is more for the patient than for us. So first of all, I want to apologize to the patients if they feel slighted by the body. It's more for them. But we are going to hold on to this strike for as long as the government is willing to make healthcare or declare a state of emergency in healthcare and make healthcare give the priority that's supposed to give to healthcare.
All right. Thank you so much for your time on the program. It's been a pleasure having this conversation with you, and we hope that a resolution happens soonest. I've, of course, been speaking with Dr. Affiong Agbor. She's the General Secretary of the Association of Resident Doctors of the Federal Capital Territory. Once again, thank you for your time.
Thank you for having me.
All right.